CNA Practice Knowledge Test 2025. Question 1. A resident is having a seizure. What is the CNA's priority? Place a spoon in the resident's mouth. Hold the resident down to stop the shaking. Protect the resident from injury and clear the area. Run out of the room to find help. Safety is key. Protect the head and clear objects away. Never put anything in their mouth or restrain them. Question 2. Which of the following is an example of objective data? The resident says they have a headache. The resident's blood pressure is 120/80. The resident feels nauseous. The resident is worried about their family. Objective data is observable and measurable information, such as vital signs. Question 3. What is the proper method for cleaning the perineal area of a female resident? From back to front, from front to back, in a circular motion, with a scrub brush. Cleaning from front to back, cleanest to dirtiest, prevents the spread of bacteria from the anal area to the urethra. Question 4. What is the primary goal of restorative care? To perform all tasks for the resident. To help the resident regain or maintain the highest level of function. To cure the resident's illness. To move the resident to a hospital. Restorative care focuses on helping residents maintain or regain their independence and physical function. Question 5. A resident is nearing the end of life. What is the CNA's primary role? To encourage the resident to eat a large meal. To provide comfort and emotional support. To discuss medical treatments with the family. To ignore the resident since they are dying. Palliative care focuses on comfort, dignity, and support for both the resident and their family. Question 6. How often should a resident who is unable to move be repositioned? Every hour, every 2 hours, once per shift, only when they complain of pain. To prevent pressure ulcers, immobile residents should be repositioned at least every 2 hours. Question 7. Which of the following is a normal part of aging? Loss of all memory, slowed reflexes and reaction time, incontinence, constant pain. While some decline is normal, like slower reflexes, things like total memory loss or incontinence are not normal parts of aging. Question 8. A resident's tray has a full glass of water, but the resident is on NPO status. What does this mean? Nothing by mouth. Next patient only. Needs physical observation. Nutrition per oral. NPO stands for nil per os, meaning nothing by mouth. No food or water should be given. Question 9. An ombudsman is someone who provides medical care to residents, advocates for the rights of residents in long-term care, manages the facility's budget, inspects the kitchen for safety. An ombudsman is an official advocate who helps resolve complaints and protect resident rights. Question 10. What is a common sign of a urinary tract infection, UTI, in an elderly resident? Sudden confusion, increased appetite, better sleep, improved mobility. In the elderly, UTI is often present with cognitive changes or delirium rather than just physical symptoms. Question 11. What is the normal range for an adult's oral temperature? 96.6 to 98.6 F, 97.6 to 99.6 F, 98.6 to 100.6 F, 95.0 to 97.0 F. The average oral temperature is 98.6 degrees Fahrenheit, with a normal range typically between 97.6 degrees Fahrenheit and 99.6 degrees Fahrenheit. Question 12. Which of the following is a sign of dehydration? Clear, pale yellow urine, moist skin, dark, concentrated urine, increased appetite. Dark, strong-smelling urine and low output are classic signs of dehydration. Question 13. When dressing a resident with a weak right arm, which arm should be dressed first? the left arm, the right arm, both arms at the same time. It doesn't matter. When dressing, always start with the weak or affected side first. Dress affected/weak. Question 14. When should standard precautions be used? Only for residents with known infections. Only when the resident is coughing. For every resident at all times. Only when the nurse tells you to. Standard precautions are designed for use with all patients to reduce the risk of transmission of pathogens. Question 15. What is sundowning? Increased confusion and agitation in the evening hours. Sleeping all day and staying up all night. A skin condition caused by the sun. The resident feeling better at the end of the day. Sundowning is a phenomenon where confusion and behavioral problems worsen as daylight fades. Question 16. A resident is choking and cannot speak or breathe. What should the CNA do? Perform the Heimlich maneuver, abdominal thrusts. Offer the resident a glass of water. Wait for the nurse to arrive. Hit the resident on the back. Abdominal thrusts are the standard emergency procedure for a conscious person with a complete airway obstruction. Question 17. A resident refuses a bath. What should the CNA do? Force the resident to bathe. Skip the bath and try again later. Tell the resident's family. Document that the resident is difficult. Residents have the right to refuse care. The CNA should respect the refusal and try again at a different time. Question 18. When measuring a resident's blood pressure, the first sound heard is the diastolic pressure, pulse pressure, systolic pressure, mean pressure. The systolic pressure is the top number and represents the pressure when the heart contracts. Question 19. When a resident is on a bladder training program, the CNA should restrict the resident's fluid intake. Take the resident to the bathroom on a scheduled basis. Tell the resident to hold it as long as possible. Always keep a catheter in place. Scheduled toileting helps the resident regain control and awareness of bladder function. Question 20. Which document describes the tasks a CNA is legally allowed to perform? The resident's care plan, the CNA's job application, the state's scope of practice, the facility's menu. The scope of practice defines the legal limits and responsibilities of the CNA role in that state.